Thank you for your presence at the 2018 Center for Human Services Community Gala, Dinner, and Auction. We are extremely grateful for your support and hope you are enjoying your time tonight. For those of you who may be unfamiliar with our organization, we would like to share with you what the CHS mission is and how we accomplish that mission. We first believe it's important for you to know why we do what we do and the current crisis we see in our communities. Since the 1980s, homelessness has been consistently increasing in the United States. Recently, it has only continued to surge, and the crisis does not stop there. Communities all over the nation are hurting. 46% of Americans can't afford a $400 emergency. Medical debt is the #1 cause of bankruptcy, and drug overdose ranks first as the #1 cause of accidental death. These alarming statistics are especially of concern in our area, ranked 10th in the U.S. for the highest cost of living. CHS serves many of our most vulnerable neighbors. A 2015 study published that more than 11% of adolescents in Washington state reported using illicit drugs within the past month, and 14% reported binge alcohol consumption. According to the most recent U.S. Census, substance abuse is affecting over 100,000 adolescents each year. This year, nearly 64,000 Washington state adolescents suffered from a major depressive episode. King and Snohomish County reported over a quarter of its youth had depressive feelings during the past 12 months, and suicidal thoughts and attempts are not uncommon. This leads to poor academic performance, higher likelihood to be involved in violence, and increased drug use. This photo of a man camped underneath I-5 displays Seattle's homeless epidemic, which continues to be an enormous challenge in our community. King County has the third highest homeless population in the country. Tonight, an estimated 5,400 people in Seattle will sleep in a car, tent, or on the street. Many of them have families and children, and emergency shelters fill up too quickly to provide refuge for everyone. Snohomish County, too, is dealing with poverty, especially amongst children and families. According to the most recent census, families with children were more likely to be impoverished than families without, and 30% of those families were headed by a single mother. 13% of children live in poverty compared to 9% of adults and 6% of those 65 and above. This foreshadows an alarming trajectory for our children's future. Homelessness and poverty are common byproducts to insufficient access to mental health and substance abuse services. As economic factors further compound these issues in King and Snohomish counties, it is paramount that communities and organizations like CHS band together to fix this at a local level. Every day we see individuals and families, young and old, men and women, struggling to get by. It is CHS's mission to instead see them rise. This is why Center for Human Services began. For nearly 50 years, CHS has been focusing on underserved communities in King and Snohomish County to provide a variety of services, supporting these individuals to help them strengthen their talents and skills to return to our communities. Our community is only as strong as the support we extend to it. CHS embraces and provides easy-to-access services, weaving diversity into programs, actions, and results. We believe in collaboration, as we know it is only with the support and innovation of many that we can serve the needs of a vibrant and multifaceted community. Our programs inspire to promote creativity and strength to our clients, and most of all, positivity to the children and families served. Our approach is strength-based, client-centered, and family-focused. We see communities as a network, gathering friends, families, and neighbors together. It is important to our organization that both employees and clients alike understand the holistic values that a person has. Through developing their talents and skills, our clients empower themselves and their families to grow. We love celebrating with our clients as they progress through our many programs. Recently, one mother wrote in saying, "The access to many different materials and games has helped my child develop in multiple areas, from counting and identifying letters to coordination and creativity, as well as social skills, cooperation, and overcoming shyness. For nearly 50 years, we have found our clients to be most impacted by an approach which empowers participants to draw upon their own strengths in order to move toward creating change within themselves. We also know through experience that individuals are most successful when the diversity of our staff parallels that found in our community. Which is why we are thrilled to share that our staff of over 100 employees speak 22 different languages. A majority of them are women, and 24% identify themselves as gay, lesbian, bisexual, or transgender. 26% of our team members identify themselves as a minority. We are proud of the diversity we see in our staff, our volunteers, and especially our community served. 55% of our clients identify as a racial minority, 58% as women, and 67% are younger than 25 years old. We successfully provided services for over 18,000 people this year, totaling over 82,000 service hours. For the last couple minutes, we wanted to share with you more information on our successful programs and the diverse types of resources our community can receive through CHS. The success of our children is a holistic approach centered around family engagement. We encourage not only healthy growth of the children we serve, but also the growth and engagement of the entire family unit. Our family support programming includes Head Start, after-school youth programs, positive parenting classes, adult education, childcare, youth groups, and so much more. Adult education classes are one of the ways we impact our families through engagement. This past year, we offered over 1,000 hours of adult education classes serving 238 clients. Our classes include education resources like youth mental health and first aid and positive parenting classes. This photo is from one of our very successful Spanish parenting classes, a class highly beneficial to our 22% Hispanic client population. Positive parenting classes work to build support networks with other parents in the community while also teaching effective playtime habits to develop with their children. 95% of parents enrolled in our positive parenting classes reported an increase in their understanding of the importance of nurturing relationships, and they left feeling more supported, informed, and engaged. We believe the best start in life we can give our kids is early engagement and pre-K development. We make special consideration to fund early childhood programs such as Kaleidoscope Play and Learn, where children and their families take time out of the day-to-day life to learn together. These classes feature a special emphasis on how to utilize playtime as a means to bond and learn, both in class and back at home. Youth development is close to our hearts. This past year, we completed over 100 wraparound services where children are able to receive a comprehensive support system to achieve success at school and at home. Currently, CHS is only one of 2 organizations in the state that provides students school-based wraparound programs. At Ballinger Home's after-school program, we provide a safe space for kids to learn and grow while waiting for their parents to end their workday. None of these amazing programs would be possible without your past, present, and future support. Our networks have allowed us to bring together school districts, community centers, hospitals, clinics, and more into our community of supportive offerings. In order to continue to support our communities at this level, we need everyone's support. Please review all of our amazing partners and contributors as we extend a thank you to each and every one of them.